it's alright. I'll be your lover and your...
Gloria is looking for you.
Nope.
Anybody yet? Oh. Hang in there, kid.
A drunk driver in a crosswalk.
This is the job that keeps on giving.
Pregnant teen coming back today for a mifeprine.
Oh, and you got the med students. Good morning, sunshine.
Don't worry. You'll get there soon enough.
I was almost done.
You hadn't even made it to the...
No. Cooking. You were cooking with the string? We're gonna patch you up and get you out of here as soon as...
Pitt,
We got 2 traumas from the tea. 5 minutes.
take your patients back here, but please keep your eye... They repeat a crit.
Stable crit. Alcohol of 420.
Aspiration.
Incoming.
Go, trauma 2, let's go.
From London expected.
What's your name?
Sure, 2 grams.
Agnal respirations, GCS 5.
Back to the Marquine lasted a good 4 hours.
Okay, do we have a phone or anything?
I'm talking about Prescani score.
Beds are up there. You just don't want to hire the staff you need to carry.
Referring to the emergency department as the Pitt.
Really?
Yes, really.
Smooth muscle and the tunica media.
Really, I swear.
Oh, I know, but it's hot.
No?
Didn't take him for a lightweight, huh?
I see you when you can get a bed.
I could try.
Otis?
It's my ass. Not yours.
We figure out what she's speaking?
Last
Where your mouth is.
No, I didn't say anything.
Dr. Michael Robinovich enters the Pitt's emergency room on the 4th anniversary of Dr. Montgomery Adamson's passing. Nurses Pella Alawi and Princess Della Cruz confront him, worried about the hospital's future after learning from co-workers Simi and Hector that Dr. Derachion has confirmed the sale of the ER department. Robbie brushes off the worry, pointing out that the hospital frequently receives threats of this nature but never investigates. He is told by charge nurse Dana Evans that Gloria Underwood, the hospital director, is asking him to exercise restraint. Dana inquires about Robbie's well-being, aware of the psychological toll the anniversary imposes, but he sidesteps her invitation to speak, stating he is unwell. He finds out from Dana that Dr. Jack Abbott, who works the night shift, is outside because he is curious about his whereabouts. Later, Dana learns that Dr. Heather Collins was secretly pregnant until after 12 weeks due to morning sickness. Collins is advised to be patient with Robbie, who hasn't worked this anniversary in 4 years, by Dana, who is sympathetic due to her personal experience. Robbie discovers Abbott's long-standing rivalry smoldering: a pregnant adolescent, a patient with intestinal obstruction, and a volatile psychiatrist patient known as the Kraken are among the patients Abbott passes off before leaving, exhausted from coding a veteran hit by a drunk driver. Robbie encounters Dr. Mel King, a second-year resident, and discovers Dr. Samira Mohan, a third-year resident, paying attention to an elderly patient telling her personal journey. Robbie reminds Samira that they have a lot of other patients to take care of, and that it's crucial to keep track of each resident's patients every hour when she spends too much time getting the patient's background. The 3 medical students, Dennis Whitestaker, Victoria Javadi, and Trinity Santos, are introduced to the Pitt by Dr. McKay, a second-year resident, who explains that patients first check in at registration, where a nurse promptly evaluates them to make sure they are not in urgent condition. After that, stable patients are sent to one of 2 triage rooms for a brief chair examination and vital sign assessment, where lab and X-ray orders can be placed. Patients go back to the waiting area after triage to see if a bed is available. When Javadi asks how long patients usually have to wait, McKay says that if they are lucky it might take 8 hours, but usually takes up to 12. McKay responds that it frequently gets even busier when Whitestaker asks if it is always this busy. While making s'mores, they tend to Sherry Davis, a mother who may be homeless and was banned by a stand-up pan. Robbie rallies the crew at the Pitt, greeting and formally introducing the newcomers. Prior to sending out the team, he emphasizes the significance of the charge nurse Dana, referring to her as the department's captain and emphasizing that her directives must be carried out promptly. According to Robbie, the ER is frequently overcrowded with boarders who have been admitted and are waiting for inpatient beds, sometimes for days. He reminds everyone that beds are a valuable resource and advises them to complete patient workups quickly and effectively. He tells them to keep a close eye on the waiting area to avoid undetected decline while the sicker patients receive care in the rear. Alongside Dr. Collins, he introduces Dr. Frank Langdon, a senior resident, and explains that all residents will report to them, who will then report to him. He ends the briefing and gets the crew ready to start their shift after verifying that the senior residents have gotten their sign-outs. Langdon examines the case of Vigil Straker, who suffered a 9mm gunshot wound to the left shoulder. He notes that the CT angiography came out negative and that the surgeon had suggested that he be admitted for observation overnight. Robbie recommends releasing Straker with prescription medication for safety and instructions for a follow-up the following day after verifying that the patient's vital signs were stable and that hematocrit had stayed steady over multiple checks, arguing that the patient would receive more rest at home. When Straker Robbie is approached, he expresses his desire to return home, to which the patient wholeheartedly concurs. The team's well-known member, Louis Cloverfield, welcomes them despite having a blood alcohol content of 420. Louis makes jokes about cutting back despite the deadly level. He is sober enough for a medical examination after taking Rollout-Z-Perm twice. After introducing Charlie to Robbie, Collins informs the group that Charlie's 8th tooth was completely avulsed during a bar fight. Charlie doesn't know where the missing tooth is, but Robbie asks him to lighten up. After falling into the T-tracks, 42 years old Sam Wallace has agonal breathing and blunt head damage when an EMT arrives. An LMA is in place and cannot be intubated. The EMTs explain that Robbie is a good Samaritan who fell while assisting an old woman off the tracks in response to Robbie's question about if it was a suicide attempt. In order to promptly check the patient's status for internal injuries, the team uses E-FIRST to conduct a trauma assessment. The woman, who is brought in after a degloving lesion on her right lower leg with an open fracture dislocation at the ankle, but her vital signs are good. She has no head injuries. Just as the train approached, the woman was hauled off the tracks and sustained an open fracture and degloving lesion to her foot. The staff tests for possible arrhythmia or TIA and stabilizes her antibiotic orders. Given that her language is unknown and the handbag was destroyed, Robbie wonders if it might be a hate crime. Sam, who assisted her, is in worse shape and needs to be seen right now. Robbie is confronted by Gloria on the department's low press gunning scores, which indicate low patient satisfaction. Robbie uses the staffing shortage, overcrowded beds, and lengthy patients' wait times to defend his department. Gloria pushes him to increase patient happiness, threatening to fire him if he doesn't. Despite being irritated by the discussion, Robbie maintains his position and draws attention to the institutional problems that fuel the department's difficulties. The old woman's wounded leg is prepared for reduction by Collins and Langdon. Collins advises taking a culture from the open fibula before starting, explaining that bleeding can be significant if an artery is partially sliced. When Langdon pushes laterally to clear the tibia and diverts proximally, Collins stabilizes the knee. Javadi passes out and falls to the ground during the process. After running the Rochester Marathon 2 weeks prior, Otis Williams reports feeling particularly tired and breathless. McKay assesses him. During the examination, he unexpectedly falls unconscious despite having no notable medical history or prescription drugs. He has ventricular tachycardia when McKay and the crew start an emergency reaction. To try to re-establish his cardiac beat, they set up the crash cart and shock him. After being revived, he has another episode of ventricular tachycardia. With Dr. Collins, the team works fast to stabilize him, determining that hyperkalemia from rhabdomyolysis from vigorous exercise may be the culprit. His kidneys' capacity to eliminate potassium has been hampered by this illness. While they wait for lab findings, they quickly provide calcium gluconate since they know that another arrest might be lethal if not handled appropriately. Otis is assured that he will recuperate with dialysis and adequate fluids. His kidneys will take a week or two to heal, but after that he should be all right. McKay counsels him to treat himself well and make sure he drinks more water both before and after triathlons in the future. An 89-year-old resident of a nursing home shows up wearing a Lucas CPR machine. Whitaker hurts his nails as his finger gets trapped between the bed and the spine board while moving her to the trauma bed. She had multiple sclerosis, congestive heart failure, and emphysema. Despite receiving 3 shocks and 2 rounds of EPI, she remained unresponsive. Before calling it, the crew prepares one more EPI and shock. Joseph Spencer, 79, has mild Alzheimer's and a fever cough. He lives in assisted living. Vital signs include a pulse of 130 and a blood pressure of 90 out of 60. His POLST permits medication and fluids, but not intubation or compressions. He most certainly has a right middle lobe infiltration, a rheumacy, and pneumonia. To guarantee complete protocol compliance with blood cultures, lactic acid, ceftriaxone, and repeat lactic in 3 hours, a sepsis cord is called. When Dana shows up with a freshly faxed DNR from the nursing home, they halt resuscitation while Langdon charges the fibrator for the 89-year-old woman. They are upset to learn that the nursing home's inadequate staffing is causing delays. Robbie conducts a moment of silence to remember the patient's life as the team gets ready to inform the family, but Whitaker's phone ringtone unintentionally interrupts, and Robbie urges him to keep it on vibrate while working. Robbie is informed by Dana that Javadi has recovered from the collapse. Robbie asks her to assist McKay in the triage after being taken aback by her youthful appearance. Javadi maintains that she worked hard to acquire her position. Robbie is shocked to see that Dr. Eileen Shamsi is Javadi's mother as she approaches them. Javadi dismisses her mother to return to work after a brief, awkward exchange. Later, Javadi unintentionally uses the dustpan as a toilet to check on a cranky patient. Robbie then makes fun of Dana for not being informed that Javadi is Aileen's daughter, and Dana makes fun of him for how uncomfortable that was. Mel informs Langdon about Taylor Jones as sluggish 4-year-old boy with normal blood sugar and no past medical problems. His parents claim that although he is often lively, he had trouble waking up today. There are no indications of drug or alcohol consumption, infection, or trauma. Tests for metabolic problems are requested, including blood and urine. Santos drains Whitaker's finger because to the prior damage that occurred without anesthetic. Whitaker thinks it's snarky that she calls him Huckleberry as a joke. As they choose their next victims, they joke about Whitaker's farm upbringing and his small Nebraskan town. Minu, who doesn't speak the same language as Collins, tries to talk to him in the meantime. Collins eventually learns that Minu is from Nepal and speaks Nepali despite his difficulty understanding. McKay approaches Kiara, a social worker in the department, for assistance since he believes Sherry, the burn patient from earlier, may be homeless. When Javadi and Kiara meet, they converse. McKay learns that Javadi is 20 years old and the daughter of two hospital physicians. Later, when Javadi tries to assist Daud Driscoll, a disgruntled patient, he brutally turns her down because she is a student. David Saunders brings his mother Teresa, who has been throwing up since last night. McKay checks on her, inquiring about medications, stomach problems, and symptoms like exhaustion and lightheadedness. Otis's blood pressure spikes. Robbie discovers that his fluid accumulation has caused cardiac tamponade. They use the central line kit to perform an urgent pericardiocentesis. Otis stabilizes and his vital signs return to normal when the fluid is safely emptied. Teresa's potassium levels are low, but McKay assures her that this will be corrected and gives her Zofran to relieve her nausea. When asked about his travel history, David, who is standing in the corner using his phone, declines. Teresa can return home if the tests are satisfactory and she gets better. Whitaker notices that Benet Milton is experiencing stomachache. He recommends a low-fat diet after discovering a gallstone. Whitaker is initially uncertain, but Princess later suggests an EKG to rule out heart problems. When speaking with her patient, Teresa, who is being looked after by her 18-year-old son David, McKay raises concerns about a potential case of elder abuse. She talks of an odd dynamic she is feeling, which could indicate that Teresa was given something that is causing her to throw up uncontrollably. Robbie gives her encouragement, stating that she is adept at recognizing these kinds of circumstances. Mel and Langdon are looking into what's causing Tyler's strange drowsiness. His father, Drew Jones, discloses that the child's uncle, Danny, had given him some gummies that were stashed in his coat pocket and turned out to be cannabis gummies. After clearing out a number of potential causes, including diseases, electrolyte imbalance, and other common disorders, Tyler's lethargy and drowsiness are explained by the lab's confirmation that he tested positive for cannabis. In the meantime, Teresa tells Robbie that she used ipecac to make David throw up in order to express her worries about his unsettling behavior. She reveals that David has been making lists of girls he intends to harm, but she is reluctant to call the police. Robbie asks about any positive weapons in the house and tells her that David, being 18, must provide his consent for treatment. Teresa says she worries that David will harm himself or someone else. In order to seek David help, Robbie tells Kiara about David's concerning behavior and his mother's self-induced nausea. They talk about protecting and helping David, who might be dealing with the fallout from his father's passing and his unsettling thoughts. Robbie tries to speak with David when Kiara provides assistance, but he flees in fear after being pursued by him. He receives a call from Dana regarding a colleague student who is experiencing respiratory arrest. Robbie experiences a sudden panic attack brought on by the painful recollection of Adamson's collapse at COVID-19, which causes the urgency to change. With shouts and the sound of alarms in the background, Robbie is reminded of the challenging circumstances and the sense of powerlessness from the time as the flashback reverberates with the frenzied moments of Adamson's emergency. As Robbie tries to focus again, the stress increases. The Pitt's second episode opens with Robbie telling Dana about the ongoing situation with David, but another patient that was brought in distracts him. Nick Bradley, 19, was discovered in bed by his mother in comatose and barely alive. Robbie notices that Collins is obviously feeling under the weather, so she arranges traffic and orders many tests to determine the cause. Robbie informs the parents that Nick has tested positive for fentanyl after receiving the findings. Unfortunately, Robbie has to break the terrible news that Nick is now brain dead because he remained unconscious for some time before being discovered. We also learn a little bit more about Huckleberry at this time. After receiving some positive remarks from a patient named Milton, he opens up and shares that he is the first person in his family to attend college and pursue a career in medicine. Robbie stops him to see how he is doing when he is on his way to give Collins his information. In a similar vein, Robbie commends him for his effort in paying attention to the nurses. A child who crashed his bike and injured his face is the subject of another significant lawsuit. He obviously needs surgery. When we hear Langdon inspecting the child's head, there is a very serious crack. Despite their disagreement over who should administer what treatments, the doctors manage to collaborate and assist the patient. To Melissa King's astonishment, it appears that this is merely light-headed banter between Langdon and Mohan, but they do have a fiery personality. If you can recall the patient who was supposedly shoved onto the metro rails in episode 1, it looks like this might be a hate crime, and a police officer sees Jay Underhill discussing the patient with Dr. Collins. He also makes an attempt to court her, but she rejects him right away. It's interesting to note that Robbie observes this from a distance, and Collins quickly silences him when he asks her about it afterwards. More drama also arises when Crush discovers that Dr. McKay, whom she has been observing and following for the first 2 or so hours of this hectic day, actually wears an ankle monitor. She seems to be doing the best she can for her child as a single mother. Following this, there is additional drama with the patient who has tested positive for THC. The mother is upset because her spouse put these gummies in his pocket for their child to eat, which has led to arguments between the parents. Robbie is able to diffuse the situation, which is fortunate because security is on the verge of being called in to take the mother out. In the hallway, Langdon quickly tells Mel that everything will work itself out because they are a white couple and not black, therefore it will likely be settled with a slap on the wrist. Mel discovers a new case, a man identified as Alex, who has been fatally shot in the side while going outside to get some fresh air. He is taken right away to the emergency room. Robbie then talks to Teresa and urges her to get in touch with David. It's still touch and go, but she can't connect with him, and since he has no violent past, it might work to their advantage. Robbie and the others go up to the roof to bring in a new patient, an electrocuted man who has sliced into live wire. After more jokes with the executives upstairs, Joyce, a frightened patient, is taken back to the emergency room and given morphine right away. Many physicians, including Huckleberry, initially think she is a drug addict, but it turns out she has sickle cell disease. Inevitably, Huckleberry's days takes a turn for the worst when he learns that Milton has crashed and is clearly dead while performing CPR, respectively. Robbie lets him go on, and as the episode comes to a close, the camera pans out to show the pointlessness of his deeds in the face of such chaos. Whitaker continues applying compressions to Mr. Milton at the start of hour 3. Panting and exhausted, he feels his ribs break beneath his palms and briefly panics. He is gently reassured by Langdon that breaking the rib during CPR actually indicates that he is exerting enough force. Donnie affirms that the 3rd round of adrenaline has been administered, but there is still no indication of life. Langdon steps aside grimly and tells them to call him if the patient returns, while Whitaker fervently hopes for a miracle. Later, Langdon inquires about Pella's children's pets. She jokes about the agony of flashing a guinea pig and hiring a plumber, but she claims that her home is full of animals, only pets that quote-unquote can be buried at sea, not dogs or cats. Victoria approaches Langdon and informs him that her asthmatic patient is getting better and will soon be released. When Victoria casually inquires about Dr. McKay, Langdon just knows that McKay has a kid and maintains a private life. Dana and Langdon talk about the delay in getting patients to the operating room and making room for beds. Robbie's decision to retain the brain dead overdose patient Nick Bradley in the emergency department causes them to argue. Langdon believes it wastes a bed, while Dana believes it helps the bereaved family. Collins also asks Minu about her suffering and how she is feeling after Langdon makes jokes about patient cases, and Dana calls him a quote-unquote kid she never wanted, end of quote, through a translator. Minu replies that she is thirsty rather than in agony. Collins says that liquids are not permitted prior to surgery, but Minu is grateful when Collins gives him lemon swabs. Collins chuckles and acknowledges Minu's congratulations when Minu inquires about Collins' due date, which the translator confirms. Robbie tells Mr. Spencer's family that his condition might not get better for hours, days, or even forever. He acknowledges that the circumstance is challenging and extends empathy for the family's emotional state. Collins discusses the Bradley parents' request for updates on their son's test with Robbie. He also brings up the problem of rats in the emergency room, which Robbie brushes off as unrelated. When Samira requests Robbie's assistance with a sickle cell crisis, Princess tells him that there are no rooms available in the intensive care unit. In response, Robbie sends the electrified patient up there anyhow. Robbie rejects Santos' suggestion to try a pericardiocentesis for practice as Whitaker keeps applying chest compressions to Milton, underscoring the gravity of the situation. Whitaker declines Mel's offer over respite. Even though Robbie eventually requests that the compression be stopped, Whitaker persists in doing so for a further minute despite the patient's absence of rhythm. When someone rushes into the emergency room pleading for assistance for her friend Jenna, who is unconscious in her car, chaos ensues. The crew acts quickly, giving Narcan. After being sprayed with Narcan, Jenna eventually wakes up after first failing to respond and appearing critical. When Samira questions Jenna, she acknowledges that she originally took a Xanax because she was having trouble falling asleep. Whitaker, meanwhile, considers the loss of Mr. Milton his first patient and discusses with Mel how to deal with death in the medical field. Joyce is informed by Robbie and Samira that a new area on her chest X-ray may indicate pneumonia or acute chest syndrome, a sickle cell consequence. To be safe, they will begin taking antibiotics, a microlide, and a third-generation cephalosporin. Robbie assures Joyce that she is in capable hands and that she appears to be familiar with the procedure. Collins tells Santos that humility must accompany confidence when she asks whether she can perform a chest tube at some point. The squad assembles around the deceased Mr. Milton. Robbie conducts a debriefing. They looked for reversible reasons, but Whitaker acknowledges that Milton ought to have been monitored sooner. According to Robbie, no one could have predicted cardiac arrest, so being released was standard of care based on the evidence. After Whitaker says a few things about Milton, Mel clumsily claps in an attempt to diffuse the situation, and there is a brief period of stillness. After that, Robbie reassures Whitaker that it wasn't his fault and that despite the fact that it's never easy, learning to live with loss is a necessary part of the job. Jenna is reassured by Casey and Victoria that she will get better and they will keep an eye on her for a few hours to make sure she doesn't require any Narcan. Additionally, Casey suggests that Jenna text her friends to alert them about the risks associated with street narcotics, particularly fentanyl. Then Santos goes up to Victoria and mockingly acknowledges that she occasionally comes on too strong due to insecurity. She apologizes in jest, says she wants to be friends, and requests a recommendation letter from Victoria's mother. Victoria is dubious, wondering if Santos truly needs her mother's assistance for a potential project. Victoria unwillingly and uncomfortably returns Santos' fist bump when he validates her purpose and suggests they are now friends. Robbie informs Nick Bradley's parents that their son will be on 100% oxygen throughout the apnea test, but he won't breathe from the ventilator for 10 minutes. He is brain dead if his carbon dioxide levels go excessively high, which would indicate that his brain stem isn't working. Robbie sighs and he leaves the room, trying to be optimistic for them, even though he knows the outcome is almost probable. Hank, an irate construction worker who was shot in the chest during a fight, is later introduced by Mateo. Despite his frequent profanity and grievances about the hospital, the team promptly determines that he has a severe cardiac damage that requires immediate surgery. While Hank threatens negative Yelp reviews, they stabilize him, control his agony, and get him ready for the OR. Quote unquote, from your mouth to God's ear, Robbie dryly replies as they move quickly to save Hank's life. Mel gives Kiara an introduction. Tyler, the younger who consumed a marijuana gummy, is stable in pediatrics. His parents are with him. CYF will conduct a house visit and no police action was taken. Kiara informs her, reminding her that they have already met. Mel is content and Kiara says Tyler will be alright, but the parents may require counseling. Mel is enlisted by Langdon to assist with a STEMI case, highlighting the objective of a 51-minute door-to-balloon time. While Casey makes fun of Collins for quote-unquote stealing her medical student, Collins helps Victoria perform an intubation on Hank, the patient with the nail gun. The team prepares for an emergency thoracotomy while Hank collapses due to cardiac tamponade. Victoria's desire to go back to triage to assist in evaluating the numerous patients who are waiting demonstrates her dedication to patient flow. Robbie tests Santos's surgical technique as she assists with suction during thoracotomy. Just as Dana informs Robbie that the STEMI patient has arrived, Robbie successfully removes the nail and stabilizes Hank's heart wound before handing the patient off for OR transfer. Robbie is promptly informed by Langdon of Mr. Ed Galling's serious heart attack, classic quote-unquote tombstone ECG abnormalities. Robbie keeps Mr. Galling composed while preparing him for an emergency heart catheterization by humorously explaining the serious circumstance. Concerned about Nick following the apnea test, Lily Bradley asks Robbie if the findings are available. Robbie responds that the blood test still has to be processed and promises to provide an update shortly. Robbie returns to Hank's case in the interim, supervising a successful thoracotomy with adequate bleeding control and getting Hank ready for OR transfer. Mel joyfully gives Santos a high five after saving both Hank and Mr. Galling, a STEMI patient. Santos is still in awe of Mel's ability to have a beating heart. They make jokes about celebrating, but they soon get back to work prepared to take on more patients. Robbie emphasizes to Whitaker and the group the importance of their STEMI, quote-unquote, door-to-balloon time, pointing out that quick action can stop heart attacks and that their performance is monitored by the public. Robbie gently reminds Whitaker that even doing everything correctly doesn't always result in the desired goal, as he considers a recent loss and expresses thanks for being trusted with complete responsibility on Accord. Later, Joyce, a sickle cell disease patient, shares her extensive medical background with Samira. Samira is asked whether there is a problem by Robbie, who implies that she is spending too much time with one patient. Robbie emphasizes the pressure and speed required in emergency care and tells Samira that she should be seeing more patients as a that-year resident. Samira says that she is now managing 2 patients. Samira calls herself quote-unquote slow-mo and admits that she works slowly because she is afraid of making mistakes. Robbie agrees that worry is normal but cautions that working too cautiously can potentially hurt patients, hinder learning, and waste resources. He advises her to strike a balance between efficiency and caution, and if she is unable to do so, he suggests that she look into another field, such as psychiatry. Robbie urges Samira to embrace the fact that mistakes will inevitably be made in the future while still moving forward, because she is adamant about wanting to remain in emergency medicine. He dispatches her to clear beds and preserve lives while she assures him that she can manage it. At some point, Myrna says to Dana she would like a cup of tea. Myrna praises Dana for agreeing to get her some. Then, as her father has begun to relocate, Helen asks Dana whether Robbie is available. He is with a patient, Dana says, but she'll let him know. Robbie is talking to John Bradley and Lily, who are concerned about their son's health. He argues that carbon dioxide levels grow above 60 in the absence of spontaneous breathing. Nick's brainstem is not causing him to breathe, as indicated by a level of 82. Robbie tells John that they can fix it when he asks. It doesn't heal by itself. John wonders if the test is 100% accurate, and Lily is adamant that there must be something else they can do. Robbie informs them that a cerebral perfusion study is an imaging test, but he also warns them that it will be the last test. If there is no blood flow to Nick's brain, there is little doubt that brain death has taken place, which means that Nick is dead. The princess is then instructed by Robbie to contact nuclear medicine. Robbie is informed by Dana that Mr. Spencer in Central 9 is currently in mild restraints after attempting to remove his ET tube. Robbie suggests they should take more propofol, but he is not shocked. Additionally, Dana informs him that the slain MVC veteran's sister has just entered the viewing room in chairs. She consents to place her in the family room and promises to have Princess and Bella arrange the body as best as they can for viewing. Dana is asked by Robbie to watch Whitaker more closely today. Given that he recently lost his first patient, Dana is already on it. According to Robbie, he doesn't want Whitaker to become distracted. Robbie responds that he wants to give Whitaker an opportunity to prove himself when Dana taunts him and asks if he is certain he has game. Robbie is designated as Fruitcake by Myrna. Myrna tells him that she killed her husband through placing him through a meat grinder when he asks what she is in for today. Whitaker approaches the nurse's station in search of a case. Robbie advises him to simply grab one and dive back in. He tells Mr. Forton in Central 14 that all he needs to treat his jarred is a dose of Mylantar and suggests that he refrain from eating anything that has the word quote-unquote flaming hot in it for a few days. Whitaker requests some Mylanta from Tyler. She advises him to check the staff first aid cabinet if he wants it quickly, but it will take some time. Samira agrees to show up and informs him that it is in the lounge. Samira inquires about his well-being while they stroll because she has heard that he has lost a patient. Whitaker claims that things are not going well for him. He is informed by Samira that it is not his fault. That doesn't make things feel any better, he claims. She tries to lift his spirits by telling him that she was reprimanded for moving too slowly and reminds him that it's part of the job. She is confident that the remainder of his shift will be improved. Samira tells Whitaker to shake the Mylanta before grabbing it. He does, but she tries to caution him to make sure the lid is securely screwed on. He is covered with Mylanta. Everyone appears to get along like family, Mel informs Santos. Santos disagrees, stating that she believes each man should be free to do as he pleases. Given that Javadi's mother works as a surgeon upstairs, she continues, it is not quite accurate. Mel explains that her mother is highly aggressive, malignant pheochromocytoma. Santos replies that her mother is likely to live forever, which is awful. Opa claims that Jenna was unquestionably dead, that her heart had stopped and she was indeed dead as she passes by while on the phone. Santos asks Mel in jest if she believes Jenna was dead. Mel becomes perplexed and Santos clarifies that she shields herself with humor and sarcasm. Mel is grateful to Santos for confiding in her. It was pleasant speaking with her, according to Santos. Mel agrees, adding that she hopes they may become friends, but Santos has already left. Robbie declines Dr. Santos's offer to assist him in Spencer's room, preferring to take care of things on his own. Spencer's blood pressure starts to decline even though he is already receiving full oxygen assistance. Robbie clarifies that conventional therapies such as intravenous fluids would exacerbate his illness by flooding the lungs. He talks about a potential procedure that would involve inserting a catheter into the heart to deliver the potent drug levofield, but he cautions that there would be minimal benefit and that it would result in more organ damage. John Bradley waits nervously outside the room, fearing the worst. Dana tries to use prayer to console him. Afterwards, John discovers Jenna, an adolescent who overdosed, and blames her for giving his son Nick narcotics. In response, Jenna says that Nick gave her the medications. John, overcome with grief, yells at her, making a disturbance until Dana calls for security, at which point chaos breaks out as he holds Jenna responsible for his son's demise. Medics and security personnel are talking about the stolen ambulance at the beginning of the fourth episode. The location of a stolen ambulance is the subject of bets. When Dr. McKay requests Mateo to return Sherry Davis, Mateo tells her that she has left and is unsure if she will return. Mr. Spencer is extubated by Doctors Langdon and King, and Robbie tells his kids that Dad can survive without it for 30 minutes to several hours, but he will receive morphine for any pain. Jeremy Spencer remembers his father's time spent working on Mr. Rogers' neighborhood. Tells Helen Spencer that they are doing morally wrong by not putting him through operations that would simply postpone the inevitable when she starts to get upset about the situation. Jenna's roommate gets expelled from the medical examination because she causes distraction. Jenna finds it difficult to accept Dr. Santos' attempt to utilize distraction as a tactic. Dr. Mohan advises Dr. Santos that accepting the reality of a situation is a preferable course of action and that diversion is a horrible tactic. In the meantime, Peggy Baylock, who had a cockroach in her ear canal, is being treated by Doctors Langdon and King. Wendell Stone enters the ambulance bay at the same moment after being struck by a speaker tower. According to Dr. Santos, it was an isolated chest trauma with a clearly flail chest, no pneumo on pokers, and good vital signs and SARS. He has pneumothorax, according to his CT scan, but surgery is not necessary. Tension arose when Dr. Santos gave the order to put him on BiPAP. Dr. Landon criticized her use of the BiPAP and was upset that she didn't consult him first because it had negative effects. Dr. Robbie tends to Mr. Spencer a few rooms over to help him feel more at ease. Dr. Robbie starts seeing flashbacks to the day Dr. Adamson passed away as Jeremy Spencer starts speaking to his father. Dana also tells Dr. Robbie that the quote-unquote Kraken has woken up, is in methamphetamine-induced psychosis, and is past time for his prescription. In order to render him unconscious, Dr. Robbie prescribed midazolam and Haldol. An agitated 5-month-old interrupts their talk. Given that the baby is healthy and has a vital sign, the mother and medical professionals are at a loss. They found that a hair tonic-weight was the cause of her irritation. Dana comes up with a strategy to defeat the Kraken. Whitaker, Kim, Donnie, Pellar, and Larry were also involved. The Kraken urinates all over Whitaker while trying to restrain him, which makes Pellar declare that Whitaker has earned his quote-unquote yellow wings. Tasha, who suffered an arm cut during Barakat Karafi, is returned by Jabadi and Dr. McKay. Her arm was still inside when the neck broke while she was demonstrating to a co-worker how to polish it. At the conclusion of Tasha's visit, Javadi notifies Tasha that her chart contained a misgendering issue because Tasha was assigned male at birth. In order to prevent her from being misgendered in the future, Javadi went ahead and corrected it in the database. Dr. McKay remarks that it was a good catch and Tasha thanks him. Christy Wheeler and Lynette Wheeler, who says she is her mother, are taken back by Dr. Collins, one of Dr. Abbott's patients from the prior shift. Christy Wheeler was scheduled to return at 6 in the morning. Christy wanted to get an abortion with medicine. Jenna tells John and Lily Bradley that she and Nick were part of a study club that would stay up late to study at the same time. Then she informed them that Nick was being kind and picked up the Xanax for them because a female in their study group knew how to get it. Doctors King and Mohan examined 12-year-old Jia Yi, who was brought to the emergency room after experiencing persistent suprapubic pain for 6 weeks. Although Jia Yi has never had a menstrual cycle, Dr. Mohan concludes that she has primary amenorrhea because she exhibits early secondary sexual characteristics, including breast development and widening hips. According to Jia Yi's father, her mother passed away from colon cancer. Upon examination, they discovered that Jia Yi has an imperforated hymen which can be repaired with a small amount of surgery. The stolen ambulance, which is traveling eastward towards Mondoville, is currently making headlines. Princess tells Dr. Robbie that Mr. Spencer is having agonal breathing and that, quote-unquote, it's time for him. Dr. Robbie examines him after he has taken his final breath and verifies that he has passed away. A patient in the chair seizes as the episode comes to a conclusion. In the Pitt's 5th episode, the man from the waiting area who passed out during a seizure is taken to the emergency room. Santos is still in shock about her error from the past episode, so Dr. Langdon gets right into this. She is combative and doesn't agree with Langdon, but as he is the senior officer, he has the the final say. After Robbie initially supports him while attending to the patient, Langdon chills down Santos when they are by themselves. Langdon advises her that if they are to collaborate effectively, she must begin to trust him. But Santos is fixated on the lorazepam vial because he thinks the tight seal might be a problem. After discussing it with Dana, she gives Santos permission to look into it and determine whether her worries are valid. Whitaker, meantime, meets Bob Chazen, his most recent patient. He is a biker who had a leg injury in Utah 10 days ago. Even though it's a very severe injury, the treatment appears to be fairly straightforward, especially given his diagnosis. Whitaker says he is fine after losing a patient early on, but he is unhappy with being assigned trivial situations. However, it's better to be cautious than sorry. But the blood blister he is given explodes, splattering Whitaker with blood. It appears that he missed an artery here, and he will require fresh scrubbing once more. To everyone's surprise, Mohan arrives and offers assistance, revealing that the man's life was actually spared by the cut at Rioli. Whitaker, however, spends the remainder of the day in morgue scrubs. Dog is still furious as he waits to be seen outside in the waiting area. 5 hours later, when Dr. McKay and Jabadi go to the waiting area, he confronts them. Dog will now be seen, but only for a temperature check before returning to the waiting area. Regarding McKay, she tells her new patient that she has been clean for 9 years and that she wants to regain custody of her kid. She attributes it to a miscommunication, but it's good to see that this show is revealing the reality about what's going on with her in a very natural way. In another scene, Robbie tries to get Collins to fabricate documents for Christy, a pregnant 17-year-old. She declines to take on this case because it is so personal to her. Robbie then assumes control. Collins is quite appreciative of him filling in for her, and it's clear that they have a connection. It comes out that they had a brief romantic relationship in the past. In the midst of all this chaos, an old woman named Ginger Kitajima is brought in as a new patient. She says she just tripped after falling in the rose bush, but we quickly find out that she has schizophrenia and that her shoulder injury seems to be isolated. She seems like she will be in and out of here quickly, and she has a terrific sense of humor. Ginger's daughter, who is her primary caregiver, finds it difficult when she must wear a sling for 6 weeks. Melissa attempts to comfort her because she has experienced this with her sister as well. Rita, Ginger's daughter, is having difficulty, but she suggests that she attempt to seek some assistance. Melissa comforts her again, emphasizing that she must take care of herself and that caring tiredness is a serious issue. Unfortunately, things don't work out when Javadi enters and talks about Kiara and childcare. McKay advises her to attempt to develop empathy with patients rather than passing judgments on them. But when Rita doesn't pick up Ginger, it seems like she's done a runner, which might have been made worse by Melissa's remarks. We find out that Joyce is not receiving enough oxygen and will require intubation to save her life when Robbie and Mohan check on her in the meanwhile. Although it's a significant decision, Robbie informs Mohan in private that she must begin treating her like a patient rather than a friend. She could be caring for other patients instead of squandering valuable time. Speaking of patients, Whitaker's next patient is a man named Travis who was brought in with bleeding after a tonsillectomy. As Robbie leaves to call the child's parents, he discovers that Mohan hasn't yet completed the consent paperwork, which irritates Robbie. Robbie yells at her to move on. Collins, however, appreciates her intimate relationship with patients and tells her that this is part of the job's purpose and that she is doing a good job. As expected, Travis begins to throw up blood and Whitaker is doused with it. The patient seems to be going to be alright as everyone rushes in to assist him. However, there are a few significant revelations as the episode comes to a close. Christie's mother arrives at the emergency room, furious while the runaway ambulance crashes and the nurses get ready for some new patients to arrive. It turns out that Christie's sister Lynette is the one posing as her mother. Unfortunately, Christie's mother has the last say over whether or not to proceed as a minor and she declines to permit an abortion. The Pitt's sixth episode opens with Christie's mother arriving at the emergency room, furious with her daughter. Robbie is able to break up a heated altercation that breaks out in the hallways outside before things become really bad. Unfortunately, Robbie encounters Gloria in the waiting area, who is standing next to Dr. Tracy Morris, the regional manager of ECQ America. They have been talking about integrating this ER into an expanding conglomerate, which is an outside business that manages ERs across the nation. Robbie is aware of the implications of this, though since he knows that the physicians' salaries would be reduced and the facility would be operated more like a company than a medical facility. Gloria just doesn't see it and wants them to handle the patients' satisfaction levels with the resources they have, even if Robbie points out that they need more employees to handle the 6-hour-plus wait time. Melissa is frustrated that Ginger's daughter is still missing and is unsure of what to do. Although she is advised to talk to Kiara, it is actually Dana who assists her by telling Melissa in the corridor that she is not to blame. Melissa's involvement in the situation is largely due to her sister, for whom she provides care. She ends up answering a call outdoors at lunch to see how she is doing. In the meantime, 45-year-old Silas Dunn has arrived as a new patient. He felt a little lightheaded and fell off an 8-foot ladder. Dr. Garcia gives Santos a little flirtation while the physicians are taking care of him, but we have also added more trauma victims. The stolen ambulance's 18-year-old driver is acting rudely. They must remove his collarbone because it is pressing against his windpipe. To be honest, it's somewhat binary, but it works. Robbie visits Mohan and her patients, one of which is a woman with poorly executed silicone butt implants. Her sickle cell sufferer appears to be doing well as well. Robbie calls a team meeting, which brings the interns back together. He is the ideal illustration of a manager caught in the middle, having to satisfy both those at the top and those at the bottom. He wants more patients' happiness, but many physicians like Dr. Langdon are unhappy with the extra workload and simply roll their eyes. In the meantime, Dr. Aileen Shamsi goes back to the emergency room and places her daughter right away. Javadi finds it quite uncomfortable, but Dr. McKay is able to remove her from the room and spare her more embarrassment. Silas crashes on the way back down after completing the scans. However, Santos commits yet another error as he drops a blade that pierces Garcia's foot. Whitaker takes over, of course. Robbie's next difficult assignment is to talk to Nick's parents about their son's brain's lack of blood flow. Nonetheless, the parents obviously need more time and are amenable to the concept of organ donation. From this point on, we also witness Dylon, a new patient who probably has all of the male onlookers crossing their legs. They have to untwist his twisted testy. But Collins goes in the incorrect direction first. Fortunately, Dylon is ultimately alright. Given that Teresa took medication and would be dangerous, Dr. McKay persuades Robbie to keep her in for surveillance. Robbie makes every effort to get her to visit psychologist at 1:30 p.m. Collins receives her winnings from her wager on the stolen ambulance, which is a somewhat wholesome moment at Silas's family arrives and consents to remain in the waiting area. After speaking with Dana, she chooses to purchase a new stroller for her new infant. But as the show draws to a close, there is more drama when Christy locks herself in the bathroom and won't go as her mother begins to kick off outside. Robbie assists Collins in resolving the fight between Christy Wheeler's mother and her aunt outside the bathroom at the start of the 7th episode. Gloria then arrives and inquires about Robbie's patient satisfaction rating. Robbie loses his temper with her and demands that she employ more staff nurses to help handle the overwhelming situation at the emergency room after repeatedly refuting her charges in earlier episodes. After she departs, Robbie sends her mother and aunt outside and is able to get Christy out of the bathroom. In the meantime, Langdon is dealing with a difficult case involving Terence, a patient who persistently questions him about his diagnosis of sprained ankle. Mel chooses to investigate the case after discovering that Terence has autism and Langdon is compelled to withdraw. Mel communicates with Terence in a different way because of his distinct personality. In the meantime, the new resident's interpersonal talents excite Langdon, who takes a more direct approach to his medical care. In the end, Mel even succeeds in identifying Terence's issue without Langdon's assistance. Mel discloses that she has a sister who is autistic when the latter asks her how she is so adept at connecting with Terence. As a result, she has mastered the art of communicating with individuals who share her needs and meeting their unique ones. By the end, Terence even gives Mel his best wishes as he departs the hospital. Mel receives the message from Langdon, who also commends her for making a good, quote-unquote, first impression, which will surely boost her confidence going forward. Episode 7 introduces Harvey Chang and Nandi, two new patients. The latter is an influencer who experiences maniac episodes. With Jabardi's help, Dr. Mohan examines Nandi's problems. Both of them make an effort to comprehend Nandi's conduct, but they are unable to identify any underlying physiological causes. Robbie then instructs Mohan to empty one of the beds and transfer the case to the psychiatric unit. Mohan, meanwhile, is still not persuaded by the situation. Dr. Collins encourages her to continue searching and not let Robbie control her behavior because she confides in him about her misgivings. Eventually, Mohan discovers that Nandi might be impacted by one of her skincare products' high mercury concentration. Robbie is upset with her when she tells him the news and finds out that Collins approved the call. At Collins's station, Robbie approaches her and questions her about why she stands by Mohan when he is attempting to break her quote-unquote bad habits. Since he has been hostile towards Mohan and other employees since morning, Collins bites back and advises him to control his emotions. Robbie responds to her nasty remarks and reminds her that he is the ER's senior attendant as the argument heats up. When Santos learns that Silas Dune, her patient, may be a child molester, she is faced with a difficult situation. She finds out about the family situation from Silas's wife, who informs her that she has been adding progesterone to Silas's diet in an attempt to kill his sex desire. Her fear that her husband might be abusing Alana was the primary reason she proceeded to such drastic measures. Santos is shocked to learn that neither Robbie nor Kiara, the department social worker, are prepared to pursue the matter further. The hospital is bound by both the law and the procedures of its healthcare guidelines. In an attempt to push the boundaries herself, she asks Alana whether there is a problem at home, particularly in regard to her father's relationship with her. Santos continues to fight despite the young girl's silence regarding the entire episode. Unfortunately, things go wrong when Robbie and Kiara tells Silas's wife that her acts might be reported to the authorities, perhaps leaving the girl with the father. Then, in his hospital bed, Santos takes matters into her own hands and threatens Silas, telling him to avoid his daughter unless he wants to go to jail. He reluctantly agrees. While having a heart attack, Harvey Chang is taken to the emergency room. When Whitaker is asked to give Chang chest compressions, his worst nightmare comes true. Following a number of difficulties, the hospital personnel allowed the ECMO to assist in resuscitation and alleviate Mr. Chang's cardiac condition. Mr. Wallace, who rescued Minu, a Nepali woman at the train station, awakens in the meantime. When they finally meet, Minu expresses gratitude to him for saving her. Collins continues to take a personal interest in the Christy Wheeler case because she is concerned about the young girl's future despite the numerous problems that surround her. Collins finally has an open conversation with Christie's mother after multiple altercations, warning her that if she keeps putting pressure on her daughter, she might lose her forever. By the end of the episode, Christie and her mother decide to proceed with the abortion as a result of the harsh words. Collins is pleased that the matter has been settled, especially in the young adolescent's advantage. The doctor honestly responds to Dana's inquisitive question about how she persuaded Christie's mother to change her mind. Although everything appears to be going well in that regard, Collins has a serious problem when she enters the bathroom and appears pale and gowned. She finds blood seeping out of her while she sits on the toilet, suggesting that her recent pregnancy may have had some issues. The Pitt's 8th episode opens with Dr. Collins crying in the restroom. She enters a ward to perform an ultrasound on herself, shrugging off what is happening to her and acting composed. Collins is reticent and aloof when Robbie asks if she is alright after noticing her. Louis, meantime, has returned to the ward after becoming blind drunk once more. Santos chooses to investigate more because he still believes there is a problem with the vials. Dana shows her the location of all the vials, but nothing seems unusual. Rather, Santos is summoned to an amputation case where they must perform a VY flap on a man's finger. This essentially entails removing the bone, covering the space with a plastic surgical technique, and then sewing everything back together. When Mohan appears, he calls Santos into a fresh case and drags her outside. Dr. Collins is left by herself with this man who senses that something is wrong with her. However, Collins is alerted to the arrival of a new patient, a 6-year-old drowning victim, which we will see next. However, a new patient is brought in for the time being. She is in excruciating agony, has a morphine allergy, and seems to just desire Dr. Shamsi's assistance. Fortunately, Javadi is more thorough than her mother, who simply schedules a scan while Javadi walks the woman through her daily routine. It turns out that a black widow spider bit her. Shamsi appears at the exact moment Javadi is treating her, and it appears to be effective. Additionally, a man by the name of Willie is involved in a recent instance. His heart rate is dangerously low at 30 bpm, and his pacemaker isn't functioning properly. He seems to be a medical professional and has already received 3 atropine shots, particularly when he inquires about Dr. Adamson. When Robbie asks, he is clearly uneasy. Willie is somewhat of a legend here, although he is assisted and appears to be recovering. It turns out that he was a member of the Freedom House Ambulance Service. He was experiencing problems because his pacemaker was bent, but he is now recovering. In another scene, a 6-year-old victim who drowned, Amber Phillips, is wheeled in. Before restarting her heart, they must attempt to increase her body temperature. Sadly, they fail and the girl dies. Melissa is relieved when Ginger returns to the ward and acknowledges that she went to move her car and ended up falling asleep since it was so quiet. Together, Ginger discovers new ways to deal with her mother, and Melissa and Kiara provide some advice on how to deal with intense stress moving forward. When Mohan goes back to her cosmic patient, she explains that her problems are being caused by a very high mercury level. She is also addicted to social media, but they will begin chelation therapy to help remove the mercury. Mohan assists her with a social media post in an effort to raise those patient satisfaction ratings. Santos talks to Mohan in the hallway and expresses concerns that Langdon might be pilfering medications from the hospital. Santos is reminded by Mohan, who is somewhat repulsed, that she has only been here for 7 hours. We are aware of her recklessness and hate of males, and Mohan reiterates that she must perform her duties and cease interfering, refusing to even consider this possibility. Speaking of interference, Dr. McKay has a new case with Piper, a worker, and Laura, her controlling supervisor. Laura continues to respond to all Piper's inquiries since she recently moved to the area. They perform a private pelvic exam because McKay is concerned that this might be a sign of human trafficking. She is residing with Laura, so there may be more to this than meets the eye. Even though Piper claims it was from her ex-boyfriend back home, it turns out that she has chlamydia. When Melissa visits Bella, Amber's younger sister, there is a very trying situation that follows. Melissa talks about how, despite saving her life, Amber ultimately perished. Melissa tries to channel her feelings through a bear, but she isn't in a position to tell her what occurred with Amber at the moment. A somber moment occurs at the end of the episode when Nick's parents decide to donate their organs and take him on a walk. The numerous physicians and nurses here are paying their respects during this silent time of introspection. The Pitt's 9th episode opens with the cleaners coming to clean up the emergency room following Amber's passing, while the other physicians attempt to gather themselves. Collins, on the other hand, talks to Dana about her difficulties and how, because her uterus is empty, she appears to have lost her baby. She is particularly affected by Amber's passing, and Robbie gives the team a debriefing. However, a number of urgent situations in the emergency room interrupt them. Dana arrives to manage traffic as a fight breaks out in the waiting area over masks. They both need to be patched up after a punch-up, but Doug is obviously present and unhappy because he feels they have crossed the line. Langdon is there during this time, and it appears that the woman who initiated the altercation and opposed masks needs surgery. Here, Langdon makes fun of her by inquiring as to whether or not the doctors should wear masks. In accordance with her request, she decides that they should don masks. Kelly Ralston, a lady, arrives as a new overdose victim. She seemed to have overdosed on MDMA, as evidenced by her extreme heat. Even though they have prepared a nice bath, there is drama because Santos and Langdon are still at odds. While Laura keeps searching for Piper, McKay and Dana wait to spend time with her. Piper feels uneasy when McKay gives her a pen with a concealed number on it, but she is adamant that she wants to return with Laura and doesn't seem to want it. Working with Kiara to try to find a solution for Piper is part of McKay's resolve to do everything in her power to save this patient. She is reminded by Kiara that their options are limited, but as she departs, it appears that it is too late. Robbie welcomes a new patient as she is carried back to her supervisor. Walter Pennell, 52, was seriously burnt on his leg after he was hit by a car, but Paula, the driver, is in even worse shape. In addition to having a shattered breastbone, McKay saw her that morning for a UTI. Kelly Ralston begins having seizures in the bathtub while Langdon is attending to other patients. Santos is certain that she has to be given saline since she has low sodium. Mohan accepts a major decision she makes. Langdon is upset that Santos didn't approach him first when he returns. Langdon loses it when she sidesteps, saying that Mohan made the choice and she was the one who stalled. He criticizes her for being conceited and making snap judgments, highlighting all of her shortcomings. However, Robbie hears this and pulls Langdon aside to speak. He has been watching Langdon for a long time since he is unhappy with his tactics. He instructs his co-worker to assume the role of the room's senior. Next, Langdon enters the break area and sees Melissa with Crosby, the puppy that Walter had brought in earlier. Given how close Melissa is to Amber and Bella, it is clear that she is not in a good place. After offering her some words of support and realizing that her music fails to function properly, Langdon gives her the road rash case. Whitaker discovers that the man who had earlier urinated on him is actually homeless and has been residing in an encampment on Liberty Avenue. He is going through a difficult period and doesn't have money for medications. Whitaker is grateful for his apologies and wants him to speak with a social worker. In addition to deciding he wants to join the team to assist individuals on the streets, Whitaker is able to arrange some medications for him. Javadi gives Dyers a chance, but since he doesn't date anyone at work, he disappoints her. The man, who is casually munching sandwiches, Eyal, observes the entire event and remarks that it resembles a romantic comedy. Naturally, it's also quite uncivilized, but it's hilarious. Doug loses control on the walk back to the waiting area, but Langdon uses some much-needed sarcasm to calm him down. Naturally, it won't have much of an impact on the patient's satisfaction rate. It turns out that Santos has really dealt with drug overdoses, which explains why she called Mohan earlier. She witnessed a friend experience the same issue. This clarifies her rapid thinking in this situation. Because Santos withholds information regarding accusing Langdon of drug theft, Mohan mentions that she is a wonderful doctor. Paula, meantime, seems to have sepsis and goes into panic. It turns out she had endometritis earlier, but McKay neglected to perform a pelvic exam because he thought it was just a minor UTI. Given the patient's weight, Collins subtly accuses her of being prejudiced against her. McKay accepts the criticism and resolves to improve, moving ahead. There is drama in the emergency room during this time. Crosby follows one of those rats who escaped earlier. Whitaker arrives first, covers the rat with a blanket, and uses his bare hands to kill it. Dog just so happens to be there as Dana leaves for a smoke. He tells her he'll take his chances, slaps her across the face, and tosses the forms to the ground. The Pitt's 10th episode opens with officers interrogating Teresa, David's mother, who McKay brought in after she voiced her worries, much to Robbie's displeasure. Due to her bleeding nose, Dana is swamped as soon as she enters the emergency room. Javadi is taken aback, but the others explain that this is a common occurrence here, adding that they have all experienced attacks. As word gets out about Grill's call, Gloria naturally worries about patients straying back with the nurses. Robbie, however, puts her right in the middle of it by pointing out that he has requested further security measures 3 times in the past 4 months and has each time been turned down. Robbie slips away, leaving Gloria to handle the irate nurses. Dana, on the other hand, is a resilient person, and fortunately her CT scan reveals no skull fractures or other complex situations. When Collins shows up to deliver the good news to Dana, they both take stock of their hectic day. When Robbie tells McKay that the police have been called, Harrison, her own son, appears out of nowhere. Following an incident involving skateboarding, Chad's father was hauled in. There is no love lost between him and the other doctors, despite the fact that he has also fractured his leg 3 times. It appears that he will be in for some time. During this time, Santos also recognizes that the medications has undoubtedly been tampered with. While Langdon watches with a worried expression on his face, she quickly informs Robbie. Santos is not in the mood to share when he questions her about the content of their conversation. Teddy, a 28-year-old man with third-degree burns, is brought in during this time. An explosion happened when he was moving gas. He is treated harshly by the group. They must give him a breathing tube since he has also burned the interior of his throat. When Amy, his expectant wife, arrives, Whitaker confronts her well in the emergency room. She mentions that he had to remove the ring off his finger because of the swelling and they were childhood sweethearts. Whitaker is called in for another emergency, though in the middle of this one. Whitaker assists in stabilizing the patient as directed by Langdon, and Robbie is present to observe and congratulate him. Sadly, all of this is for naught because, as Langdon quickly informs Whitaker in private, Teddy has a more than 90% chance of dying and he needs to call Kiara to let her know that a psychologist might be required if he dies, especially with Amy. Jane Doe, a stroke victim who also plays video games, is another new patient. A stroke neurologist is called in to examine her since she is not responding. To Melissa's evident dismay, this man, Dr. Matter, has a lot of dad jokes in addition to wanting to perform an MRI. The problem is that Dr. Mehta uses these dad jokes as a stress reliever and Mohan is available to explain why this is beneficial. She also notes that each of them has a special sauce that helps them deal with the pressures of the emergency room. Everett Young, a 16-year-old, is brought in following a line drive to his left eye. There appears to be a collection of blood behind the eyeball, and he can only perceive light. They must do surgery right away due to the seriousness of the situation. Javadi also dislikes Everett's controlling father who wants his kid to be a baseball prodigy. In fact, she has a little meltdown and accuses him of not being a father. Naturally, McKay needs to discuss with her how to keep one's personal and professional lives apart, but that's obviously easier said than done. Another rather awkward moment occurs when Mateo and McKay decide to hang out after work and Javadi adds that she is free as well. Amid all of this, Langdon confides in Robbie about his worries about Santos. He brings up all the turmoil that has occurred over the last 10 episodes and notes that she is not a team player because she is cherry-picking cases. Next, Robbie confides in Santos about the problems he is currently having with Langdon. At this point, Santos asks Langdon whether he is accountable after bringing up the treatment medications being glued in place. After forcing Langdon to open the locker, Robbie discovers the cocaine within. Langdon is consequently ejected from the building. In the Pitt's 11th episode, Robbie returns to the emergency room and orders Dana to leave. Robbie is clearly still tense following the Langdon incident, but she won't comply. Additionally, he assigns Dana to conduct a pharmaceutical audit on Langdon for the previous 3 days. Though he doesn't want to go down this path, he still finds himself spiraling, so he doesn't tell her everything. Next, Robbie tells Santos that he has sent Langdon home. She makes light of it, stating that she intended to leave a lasting impression on her first day. However, they must be fully engaged when dealing with an elderly resident. But news of what's going on and the altercation between Robbie and Langdon near the lockers has undoubtedly circulated swiftly. After Santos begs Dr. Garcia to keep the pills a secret from Robbie, Garcia reiterates what we have known through the season. Santos is more trouble than she is worth. Robbie assures Teresa that everything will be alright when David uploads a statement on Instagram that seems to allude to his mental instability. Teresa has made the decision to put David on an involuntary psychiatric hold, but it takes us the majority of the episode to circle back to her. However, it cannot be anonymous, and approval from a psychologist and social worker is required. Robbie then talks to Collins, who acknowledges that she miscarried but says she doesn't want to go home just yet. Robbie disagrees. Natalie Malone, a new patient brought in, is 39 weeks pregnant and in active labor following an SROM. Naturally, Collins takes up the case and Melissa follows suit. The baby is crowning, so they must deliver it right away. Tragically, there are issues with the birth, and Robbie must intervene and offer assistance. In literal sense, fortunately, they are able to detect the baby's respiration and heartbeat, but it will undoubtedly be touch and go for some time. In the meantime, Whitaker and Mohan treat Ivan Pugliese, a 55-year-old man who appears to be having cramps and diarrhea. But he is quite agitated, and it seems like he's pretending to have an opiate withdrawal. They choose to wait and see if he is truly funny, and we soon learn that he is. As this is going on, McKay chastises Chad for taking a chance with their son Harrison, but the temperature drops as Chad's girlfriend Chloe shows up wearing a quote-unquote bonus mom above all else. The restraining order against McKay was actually obtained by Chloe, who also wouldn't allow Harrison to return home. However, the rush of another patient interrupts the proceedings. Her daughter is obviously concerned about the patient's breathing problems. Robbie is torn between this new patient and Natalie's birth. Collins is particularly affected by the horrific problems our doctors are now dealing with, and McKay draws comparisons between herself and her mother in relation to this patient who has respiratory problems and needs a new liver. Robbie talks to Collins about her miscarriage outside of these two patients and determines that she should return home to deal with the situation. She should shut off all electronics, including phones, and simply relax. Collins acknowledges that she became pregnant a few years ago as well, but she was too scared to tell her father. Robbie begs her to forgive herself, and the two give each other a heartfelt embrace. In the meantime, Melissa finds out that Langdon has left, and if Santos could be any less likable when Melissa attempts to notify her about the delivery, she completely ignores her. Rather, Santos talks to Robbie, who reassures her that she has a powerful personality, ethical framework, and that what she did was right. Robbie mentions that Dana is an excellent charge nurse as he goes outside to where she is smoking. However, Dana is finished. Given that this is all she has known since high school, she wants to quit and has had enough of this industry. However, the distant wailing of sirens interrupts them both. Additionally, they find out that a major tragedy involving several gunshot victims from a location known as Pitt is likely to occur. Robbie recognizes that Jake and his girlfriend may be victims. Robbie is concerned that he won't be able to contact Jake on the cell phone. When word spreads that there is an active shooter at the Pet Fest, everyone in the PDMC holds their breath. As more trauma victims are anticipated to be wheeled in as a result of the Pitt Fest shooting, Robbie and Gloria talk about shifting patients out of emergency room. Seeing them get along in an uncommon occurrence, Dr. McKay gives Robbie a haphazard remark about David and whether or not he has been located. The shooting will surely result in many cases for the Pitt crew to handle, so the senior attendee gets them ready for the impending emergency. They are also the closest trauma center. Robbie is quite happy when Dr. Jack Abbott arrives for his shift, especially considering the lack of resident physicians following Langdon's termination and Collins's return home. All of the emergency kits are transported into the emergency room in disaster bins. Robbie and Dana are still unable to locate Jake. He suggests that she try to win Collins back. Melissa calls to let her family know that she could be running late to bring up her sister Becca. Since she won't be able to leave anytime soon, Dr. McKay also calls Harrison's parents to come get him. The locals debate who will assume primary responsibilities. Robbie then divides the group according to various patient needs, priorities, designating pink bands for those who will pass away in less than an hour without medical attention, and red bands for those who are closest to death. Additionally, different colors are employed for various contexts. The entire PTMC becomes something akin to a war victim response area. When Robbie goes downstairs, this is really apparent. Teresa, who has the documentation needed to place David on a psychiatric hold, is encountered by the main character. The PTMC is essentially closed, so Robbie signs it and instructs her to go home. Though she hopes not, Teresa is concerned that David might be involved. In order to console Teresa and determine what to do with David in the event that he is the shooter, Robbie tells a first responder to speak with her. Robbie gives the first round of patients a wristband slap. Omar, a youngster with hearing loss, is brought in. Sylvia, his mother, is also hurt and in need of medical attention. Melissa takes over Sylvia's care, and Sylvia insists that since her son is deaf, it is crucial that his needs are satisfied. When the resident discovers the youngster in the emergency room, he notes it on his chart. Robbie is always juggling many patients to see who needs what. Due to the overcrowding in the ORs, patients must be moved forward as soon as their needs are accessed and temporarily stabilized. Robbie is shocked to learn that Langdon has returned to the emergency room, assisting with the influx of patients. He confronts Langdon about it, but the lack of skilled emergency physicians prevents him from doing much. Grayson Cooper, a 68-year-old patient, is brought in. He sustained a gash wound after a bullet grazed his scalp, but he is still alive and Robbie accepts him. Robbie evaluates the situation once more with Dana, who informs him that although Collins and Jake are still missing, their heads are still above water. Robbie goes downstairs to see how the first response team is doing. They are busily classifying patients according to their needs. While a few police officers are questioning Teresa, press reporters have already gathered at the base of the hospital. Upstairs, Javadi runs at her mother, Dr. Shamsi, for being an intrusive teacher even in a trying circumstance. After reading the circumstances, her mother decides to leave her daughter alone. Holding the gaze to his scalp, Grayson Cooper helps out by telling the doctors to tend to other patients. Sylvia is found to be unconscious by Dr. King. They quickly determine that she has an occult liver laceration from the coalition. They give her a pink wristband. Whitaker and Dr. King encounter Langdon, who commends them for identifying Sylvia's problem. Security stops Chad as he enters the emergency room. He informs the policeman that Harrison has to be retrieved from the staff lounge. When she finds out about his relationship with Dr. McKay, she welcomes him in. Observing McKay handle so many patients on the floor overwhelms Chad. He can't be on the floor, so she advises him to go to Harrison as soon as possible. Harrison expresses his desire to be with his mother to his father. Chad chooses to spend the remainder of the evening with his kid. Melissa gives Sylvia's case to Dr. Garcia as she enters. Garcia also tells her that Omar will survive. When an unresponsive patient awakens, Langdon tends to them. Dawn is her name. Langdon enters the room with a patient, and Dr. Santos encounters him awkwardly. Their hands are currently too busy for them to engage in much conversation, but after the fiasco is over, they will probably need to deal with their tension. All hands are on deck for the time being. Dr. Mohan contacts Robbie for assistance with a patient who has extensive subcutaneous emphysema as he is finishing up an intubation. To get rid of the air, Mohan makes a few incisions on his chest. Santos notices that a patient had vanished from his wheelchair in the meantime. She is shocked since it appears that the patient was shot. She discovers that he is moving around and using his cell phone to record what is happening inside the hospital as she searches the floor. The man attempts to stage an escape when Santos calls for security. He falls into a pool of blood and is rendered unconscious. Santos informs Langdon that the man pretends to be hurt in order to enter the emergency room and record everything there. He is probably a reporter. She tosses his phone into a blood-filled garbage. The emergency room is out of chest tubes, so Dr. Shamsi has undertaken an unusual treatment. Mateo, who co-invented the technique with Jabadi, described it as quote-unquote genius. Melissa learns that Sylvia needs quote-unquote O-neg or O-negative blood because she is still in a serious condition. Melissa offers to contribute even though the ER is out of O-neg packs. There are no other options, so Robbie agrees to her idea. Other medical professionals volunteer to donate as well. In the meantime, ward clerk Lupe and social worker Kiara have their own responsibilities. They make their way to the lobby area where upset relatives are waiting to hear about their loved ones. Kiara informs them of an app and QR code that can be used to identify loved ones. They can assist identify the mountain of patients within by submitting photos of their piercings, tattoos, or birthmarks. Melissa finishes her blood donation inside the emergency room. After that, the resident puts the blood directly into Sylvia and presses the blood bag. Santos, meantime, tends to a wheelchair-bound patient who was shot in the forearm. Robbie and Dr. Abbott tend to another patient on the floor. Additionally, the former is working while giving blood due to the urgent need. Dr. Shamsi continues to intubate patients using the same technique Mateo recommended. When Robbie returns downstairs, he finds out from authorities that David's cell was pinned in the area where the incident occurred. Due to concerns that the gunman may be heading towards the hospital, SWAT has also been contacted. Robbie is still worried that his messages aren't reaching Jake and that he can't contact him. The Pitt's 13th episode opens with Robbie and the medical professionals tending to the gunshot victims. Rumors about the shooter are starting to circulate like wildfire because the SWAT team is still investigating. Javadi and Whitaker collaborate to obtain the blood during this time. As directed, they keep away from the helicopter and immediately descend to trauma to deliver the blood for the more critical cases. Naturally, everyone in this place needs blood, so the two rush to distribute it. As more night shift personnel appear, The officer brought in at the end of episode 12 is buttoned urgently. Bridget, who shows up for her shift, is one of them. She is immediately given the responsibility of keeping an eye on the new children who are currently handling their own problems. By Dana, Whitaker focuses on Buster Porelli, a children's performer who was also shot. Melissa, however, calls Whitaker aside as he inserts an I.O., pointing to him that they only use these for patients who are comatose or incapacitated. While Kiara has the unpleasant chore of taking pictures of the deceased to present their loved ones, Dr. Abbott comes to the rescue and saves the cop who was brought in last episode with a nasty gunshot wound. Sadly, one of these is a man named Vincent Riviera, and Kiara must then break the bad news to his wife. When word gets out that one of the patients has a gun tied to his ankle during the turmoil, everyone flees. He appears to solely react to pain, and the cops move swiftly to examine the man's identification. We learn that he is clear later in the episode. He doesn't seem to be the gunman. Despite this, Robbie leads Langdon towards the large man, inspiring him to take charge and save the man's life. As Robbie grudgingly leaves Langdon to tend to him, McKay's ankle monitor begins to ring, so she breaks it entirely to continue working. Although she is aware that she may face consequences, these patients are currently the top priority. If you can recall the hippie from the previous episode, Whitaker visits him, and although Grayson appears to be dead at first, he is thankfully doing well. Whitaker, however, jumps over to try to stop Carmen's bleeding when she enters with a terrible gash on her leg. As Robbie goes outside to get some fresh air, he finds out that there have been 85 patients thus far and that the hits are still coming. Soon after, another group of patients show there, but Robbie's entire focus is drawn to Jake. Leah, his girlfriend, is not doing well, and Jake looks to have been shot as well, but it's not serious. Most of the blood on him belongs to Leah. Abbott criticizes Robbie for going above and beyond for Leah in contrast to the other patients because she is not feeling well. However, he treats his friend rather gently, and Robbie obviously doesn't want to let go. But eventually Abbott intervenes to stop him after more than 4 units of blood and a cell saver. It turns out that Leah is hopeless after being shot in the heart. They risk losing 10 more patients for the time Robbie spends here if he keeps trying to save Leah. Robbie eventually stops it after realizing he has lost her. In the same way that Carmen fights with her blood loss and intermittently loses consciousness, Grayson ultimately passes out. Whitaker had to assist Jake in getting into a wheelchair because all the doctors are overworked and he is bleeding out rather severely. Santos is one physician who is still an utterly unlikable character. She keeps switching between patients, picking the most intriguing one before settling on Grayson. When Dr. Mohan arrives with an I.O. drill to puncture his skull and release pressure, she and the others are taken aback. Everyone is stunned, but Mohan handles it coolly by mentioning that she read about the patient's survival. Carmen is still hemorrhaging a lot, and it looks like the gunshot nicked an artery, but it seems to work. She actually passes out, and it appears that the blood loss is getting to her. When David arrives at the hospital, the SWAT squad recognizes him and tackles him to the ground. David still has to be examined by a doctor, but Robbie is clearly in a state of turmoil after losing Leah. Robbie leads Jake to a private area and informs him about Leah's passing while he is escorted to a different room surrounded by guards. In the midst of this, Santos considers Abbott and Robbie's instructions and chooses to perform a reboa on Carmen in order to preserve her life. She is definitely still very inexperienced and extremely conceited about the situation. She is certain, though, that she has this under control. Abbott walks over to examine what she has done and confirms that the reboa is a success, although Abbott chastises her for disobeying procedure. He later reverses course by referring to her as a badass. In the meantime, Noah Weil offers an Emmy-winning performance at the close of the episode as he tells Jake how hard today has been and how very sorry he is for Leia's passing. Robbie places 10 times more guilt on himself than Jake does on him. He ends up having a panic attack and crying because it's bringing back all those awful memories from the past. In the 14th episode of the Pitt, 8 p.m., our day shift doctors approach the end of their demanding workday while simultaneously attempting to address the Pitfest shooting. Dana begins looking for Robbie, who has vanished since he and Jake last visited the mortuary, while the majority of the crew's focus is still on the patients from the Pitfest incident. Everyone believes David was the shooter, and there are whispers circulating among nurses and patients that the gunman is being kept in a secret area within the hospital. Mel eventually begins to learn the truth from Trish, an injured patient suffering from PTSD in a different area of the floor. She was horrified when a bullet passed through her arm and into her husband's brain, killing him. Until Whitaker goes to the morgue to look for Robbie, Santos and Whitaker handle most of the cases in the yellow zone. When he sees Robbie in a state of mental instability, he pulls him up and tells him that the entire floor of doctors would be powerless without him. Whitaker returns to the yellow zone after tending to Robbie, where Santos gives him command. She moves into the red zone in search of quote-unquote more action. Robbie regains his composure and moves across the court, evaluating every situation. Gloria eventually descends to speak with him about the prior unsanctioned blood donors that could cause problems for the hospital. She also begins to chastise him for not rigorously pursuing David, especially in light of the possibility that he was the gunman. Robbie yells at her, drawing the attention of the entire wing because he is frustrated by her persistent allegations and his precarious mental state. Dr. Abbott advises him to walk down to Triage to get some fresh air. Dana goes to console Jake on Leia's death. In the meantime, Robbie joins Ellis and Dr. Shen down in Triage just as a car suddenly speeds in. Vincent Rivera's brother-in-law is the driver. The patient in the rear of the car is hypoxic and he has a bullet wound in his leg. They are both hauled in right away. When Harrison's father drops up to pick him up, Dr. McKay has a little break from her demanding life-saving work. He is less happy to see Chad when she brings him to the break room to reunite with her son. As they attempt to assist Ellis with her hypoxic patient, Santos and Langdon have an uncomfortable encounter. In another scene, Dana asks Robbie if Rivera's wife may visit her brother in the ward. Mel's PTSD patient, whose daughter is eager to reunite with her mother, is in a similar situation. He accepts both. Abbott and Dr. Mohan take charge of Brian, Rivera's brother-in-law, while his sister comes in to provide him consolation as He describes Vincent and how he was unable to save him. He breaks down in tears. As Robbie moves around the room, he spots Langdon seated with Jake and informs him that the senior attendee tried his hardest to save Leia. Gloria informs the PTMC staff that the shooter has been located on the scene by the SWAT team. David was not involved in the incident, as evidenced by the fact that he is already dead. Now that the boys, innocent Robbie and McKay, simply have a greater mess to clean up. Gloria also expresses gratitude to all of the medical professionals for their unselfish attempts to preserve lives. She adds that no new Pitt Fest shooting patient are being admitted. A new patient, a little child called Flynn Edwards, who is in comatose and was brought in via a 911 call by his younger sister, enters the room as Robbie and his physicians resume their regular routine. Shen takes the child to the ward as Mel goes upstairs with the younger girl. She and Shen become preoccupied with both assessing Flynn's issues and attempting to revive him. In the meantime, Robbie draws McKay away and informs her that it is now their duty to handle David and find a way to explain the circumstances to him. Abbott believes there may be liquid in Brian's heart in the other operating room. Walsh wants a CT scan first since he is dissatisfied with Abbott's recommended course of treatment. Robbie and McKay attempt to talk to David about his situation in his room, but the youngster is too upset with them to pay attention. He finds it unbelievable that they initially suspected him of murder. Santos takes a little snack break while Shen and Mel continue to work on Flynn's case. Alice takes up her cause and encourages her to continue working hard at her career by assisting her with the hypoxic patient. Meanwhile, Jake's mother, Johnny, comes to get her son from the hospital. Robbie informs her that Jake accuses him of failing to save Leia, but she urges him not to be too hard on himself because he is still a child. Robbie then examines Flynn Edwards' case and detects symptoms of a measles infection right away. In another scene, Ellis observes the animosity between Santos and Langdon while they collaborate on the hypoxic patient. Robbie and Mel meet with Flynn's sister in the break room to find out whether the diagnosis is measles. They receive additional proof that Robbie may be correct. Morgan, who informs Robbie and Mel that she is Trish's daughter, enters the room with Lupe. With Robbie's consent, Mel takes her to see her mother. Mateo takes Javadi aside and congratulates her on her outstanding performance on her first day, which is a pleasant surprise. All she wants is for him to remember her name. At that moment in time, Abbott pushes Mohan to proceed with his treatment plan, which Walsh is adamantly opposed to due to the absence of a CT scan. But there are no choices as time is running out. When David's mother shows there to soothe him, Robbie and McKay attempt to speak with him once again. She informs him that she has signed a petition placing him on hold for 72 hours. He is upset with everyone and won't take their counsel or get expert assistance. Outside, an irate Robbie tells McKay that because she initiated this, she ought to figure out a solution. Walsh keeps equipment on hand in case the patient needs to be revived during Mohan and Abbott's dangerous treatment. But everything proceeds without a hitch since Brian's life is spared. Santos, Langdon, and Ellis are relieved to witness their hypoxic patient's eventual recovery of consciousness in the adjacent room. He introduces himself as Max. Mel assists Trish and Morgan in meeting up Elsewhere, she starts crying as she goes outside. Robbie assures her that doctors who express their emotions for their patients are perfectly acceptable. As Robbie meets up with Flynn's parents, who have finally made it to the hospital, he encounters yet another challenge. It turns out that the mother is picky about the kinds of treatment that the doctors recommend for her son, much to the dismay of the senior attendant. She uses Gugu instead, which infuriates Robbie to the point that he loses it. To find out how Robbie is feeling, Shen follows him out of the room. Whitaker abruptly interrupts the call as he gets out of the elevator. He thanks Whitaker for helping him at the mortuary earlier and for keeping it a secret when he lost it. The intern shows that Robbie is merely adhering to the guidance given to him by his superiors by reminding him of something he stated earlier in the shift regarding striking the correct balance. A couple of police officers who are there to check on McKay's ankle monitor flag her down while Abbott and Dana talk about Robbie acting strangely for the past hour. She is honest with them about what she did to the monitor. Then, when Dana and Abbott come to her defense, they ask her to raise her hands above her head. In the season 1 finale of The Pitt, 9 p.m., the daytime physicians at the Pittsburgh Trauma Medical Center receive a much-needed respite. As a direct result of her tampering with her ankle monitor during the Pitfest shooting incident, which allowed her to contribute as a doctor, Dr. McKay was detained by 2 police officers at the end of the penultimate episode. Robbie is informed of McKay's arrest in the main lobby at the beginning of the episode. Robbie is able to get the assistance of Officer Harrelson, whose team saw McKay save lives during the Pitfest rush, who helps briefly liberate the doctor despite the police refusing to budge. Gloria eventually follows up with Robbie and Abbott, requesting that the former delegate all daytime responsibilities to the doctors on the night shift. In other news, the medical staff is still having difficulty persuading the mother of Flynn Edwards, the measles patient who was admitted during the previous episode, to consent to a spinal tap in order to make sure the boy is not in danger of dying. Robbie, irritated by the parents, shows Flynn's father what might happen to his son if the doctors are not permitted to assist by taking him to the mortuary. Dr. Mohan seemed to be in a hurry to identify additional at-risk patients while Santos and Ellis discussed some of their prior instances. The latter's personal life is called into question when McKay and Ellis advise her to manage her job and keep a clear separation between work and personal life. Later, as she descends from her high and sobs hysterically in front of the mirror, we witness her break down in the restroom. Now that the commotion of the Pitfest slaughter has passed, Langdon sees the ideal chance to convince Robbie not to disclose his negligence. Robbie is shocked by Langdon's bold demeanor and lack of commitment. Additionally, Langdon flags Dana to inquire if she can later attest to him and if there are any rumors about him. Langdon has also his own objectives, but Dana is more focused on herself because she intends to leave her position soon, particularly in light of the day's hectic events. Flynn Edwards and a patient with a crushed pelvis are the 2 main cases that alternate throughout the remainder of the last episode. Mel is in charge of the latter, with Shen and Ellis helping, while Robbie and Abbott manage the former. Whitaker searches the hospital wildly for a lost patient in the interim. Eventually, They wheel her back in after discovering her smoking outdoors. The doctors get set for their last lap and everyone prepares to return home once the cases have been sufficiently stabilized. But Robbie has a lot to think about after his most recent appointment, so he steps back and makes his way to the roof. Abbott follows Robbie up to the hospital roof because he is concerned about his co-workers' mental health, particularly after multiple out-of-character incidents in the previous 2 episodes. Abbott discovers unsettlingly that Robbie is standing on the roof's edge without any bars for support when he enters the terrace. The scene is the exact reverse of how they cross paths at the beginning of the episode. In context, we are aware that Robbie has endured a lot during the last 15 hours of his extended shift. The senior attending has been juggling a number of personal difficulties from the past, especially those related to his time working as an emergency physician during COVID-19 and his failure to save Dr. Adamson, his mentor. The losses during the current day shift have only made these problems worse. Abbott is therefore sympathetic to Robbie's choice to go over the brink. It is similar to Abbott's own struggle with sweet thoughts at the end of his shift earlier in many respects. It illustrates the weariness and tremendous amount of labor that emergency room physicians, particularly those in charge of everything like Robbie, put in. Nevertheless, Abbott tells Robbie that no matter how difficult the situation or day is, it is in their DNA to keep coming back. He subtly informs the main character that they are designed to save lives regardless of how challenging or complex the task becomes. Even Robbie's brief mental breakdown in the morgue earlier, while he is embarrassed to acknowledge, is comforted by Abbott. Abbott, however, reiterates that he is far more resilient than he believes, mostly because the psychological toll of their work is incomparable to the little break, which lasted only a few minutes at most. Robbie's incapacity to save Leia, Jake's fiancée, is the primary cause of his uncontrollable emotions, even though the string of difficult cases that were brought to his door during the day may have contributed to his mental breakdown. To make matters worse, Jake accused Robbie of not trying his hardest to save Leia, while in reality Robbie went above and beyond by devoting substantial resources to the girl's recovery. Robbie avoided Jake for a while attending to the other Pitfest patients as a result of this miscommunication. In the last moments, the senior attending chooses to make amends by going up to Jake, who is accompanied by Jamie. Despite the protagonist's desire for a better interaction, Jake dismisses Robbie in an impolite manner since he is still grieving over Leia's passing. Jake's damaged state as a result of the incident devastates Robbie. He does, however, say that he is prepared to take responsibility as long as Jake does not hold himself responsible for bringing Leia to the Pitfest event in the first place. Shortly after, he must embark on yet another devastating journey when Leia's parents arrive at the hospital to inquire about their daughter's condition. Robbie inhales deeply before going to confront them in the visitor room. He is overcome with feelings of inadequacy as he confronts Leia's parents after everything he has experienced over the day. He is further upset that there is no end in sight to the number of cases that are piling up at the emergency room. Abbott finds him when he goes to the rooftop to consider things. In the last scenes, we witness Mark Kay approach her discussion with David in a more sensible manner, appealing to his desire to improve his life going forward. She warns him that even while he might not be at fault for the Pitt Fest shooting, if he doesn't talk to a professional and work through his emotions before it's too late, he might wind himself down that dark path. David eventually reacts by listening to her and taking in everything she has to say despite the harshness of the remarks. Additionally, we witness him crying, indicating that he understands all Mark Kay is attempting to convey to him and good intentions underlying it. David eventually adopts Mark Kay and Teresa's perspective and consents to consult a professional as a result of a string of push and pull situations. Flynn Edwards, a little child with measles, is one of the season's final medical cases. Even though his obstructive parents, especially his mother, make handling his conditions difficult, this is one of the rare examples that concludes without a clear solution. Flynn's mother frequently expresses her desire to transfer the youngster from the emergency room to the family doctor's care. Robbie and the other medical professionals involved in the case, however, feel that the child needs a spinal tap to make sure he is not in danger of more serious harm, including death. Regrettably, despite the father's apparent willingness to follow the doctor's advice, the mother persists till the very end. Mel is approached by Flynn's father late in the narrative to inform her that the spinal tap is approved. Alice and Mel collaborate on the process, but they soon discover that the mother isn't watching over them. She enters the room, tells the doctor to stop the spinal tap, and chastises her husband for going behind her back while she was out for a bit. She then calls someone on the phone and exits the room, declaring that she is transferring her son out right away. Their plot is never revealed to us in the end, which probably a conscious decision. The doctors have little to no say in matters as they get ready to leave for home at the end of their shift. It demonstrates how most physicians have no influence over their cases, particularly when transferring them to the next group of emergency room physicians. The last scenes of the Pitt Season 1 finale center on our main characters' life outside of the never-ending chaos of their emergency room. As a result, the show retreats from its compelling plot to present each doctor as a person with a wide range of issues, just like any other regular human being. The special exchange between Santos and Whitaker near the conclusion is the best example of this. Santos sees Whitaker enter a private staff exit door after everyone has left for their homes. She follows him up to the staff housing section out of curiosity and learns that Whitaker resides in a private room within the hospital. After further interrogation, it becomes clear that the intern is impoverished and unable to pay for a place for himself, highlighting the difficulties he is facing in order to become a resident. After hearing Whitaker's explanation, Santos makes the decision to offer him to move into her apartment, which already has a free room, in order to help him escape his awful situation. Whitaker initially declines, stating that he is unable to pay the rent. Santos, however, shows her nice side by offering him a complimentary stay provided he keeps the apartment tidy. Long term, the incident can appear insignificant, but it gives our primary cast of characters a more sympathetic portrayal. This is especially true for Santos, who has long come across as annoying and haughty, but during the season we have witnessed her develop into a better person. Her willingness to let a co-worker live into her house for free demonstrates that she is a regular person with complicated reasons. In the future, it might even result in romance. In a similar vein, Dana is fed up with managing her position as charge nurse and receiving a hit to the face in return from Driscoll. She wants to quit her job as soon as possible, though, and put the entire day behind her. It seems like her position has affected her and caused her to doubt all she has been doing in her life. This is her last day at the hospital, as is evidenced by the concluding scenes where she sees her gathering family pictures from her desk. Thank you for sticking with me till the end. I really appreciate and I adore everyone and every subscriber to our channel. I also love and appreciate every viewer in our channel. So far, we have amassed close to 4 million views in this channel, with the goal of reaching at least 10 million views this year. Sadly, most of these viewers have not subscribed to our channel. At least 90 to 99% of the people who watch our channel, believe you me, have not subscribed. It will be an honor if you click on the red button that says subscribe and also turn on the notifications so that you may be notified when we upload new videos. I appreciate we are at 15k subs right now, and the goal is to hit 100,000 subscribers by the end of 2026. I request upon you to also hit the like button on every video that we upload so that the YouTube algorithm may think that you guys really like our channel and push it just like you do, and it does for Mr. Beast and the rest of the big YouTubers. From my heart to your ears and to God's ear, we hope to achieve this goal. Thank you for watching. See you on the next one. Alex signing out.
Put your goddamn hands up. Turn around now. That was a great milkshake. It's bullshit! Put the gun down!
What I did.
Don't you want?
Need to go now.
With several criminal organizations.
Kill me. Consequence.
This is lock this planet down.
Destiny.
Mission of Compound V. Of Homeland.
No. We hit him with the fire.
What?
Is this some kind of incest thing?
This is our last chance. witness. Why are you here? You can go anywhere. You ruin any job there is. Digging ditches. I've been doing some work on the marinade on it.
This is not. Your fans?
Plan and you simulate sex acts to apologize.
I'm happy to guide you along. Yeah, I'll just take the baby with me.
Watch for that tail.
Leave no one alive.
Zoe!
Did we?
Name of the case is Coyote.
And all of his injuries are self-inflicted.
What you're capable of.
To become public.
Year cover-up of the truth. It's the two of you. It's all.
My mom wanted to Mayfield. So he has to go now.
Ryan? Nothing can make it stop.
It's gonna kill him!
What else to be scared?
God, got this! Jimmy! Where are you? Welcome to Mr. Beast's Lab. 100 levels of unhinged science. Every experiment. Oh, snacks. This lab is impenetrable. God.